Psoriasis is a chronic skin disease, and it results in the person developing red, scaly patches all over the body. Some of the common areas of the body that are affected the most by this disease are the scalp, the knees, and the elbows. It's a non-contagious disease, and it's become fairly common among people of all ages, and it's triggered by inflammatory chemicals produced by white blood cells called lymphocytes. Many people who are predisposed to psoriasis may be free of the symptoms for years until the disease is triggered by some environmental factor. Common psoriasis triggers include infections such as a strep throat or skin infections, weather, especially cold, dry conditions, injury to the skin such as a cut or a scrape, a bug bite, or a severe sunburn, stress, smoking and exposure to secondhand smoke, heavy alcohol consumption, certain medications including lithium, high blood pressure medication and anti-malaria drugs, or rapid withdrawal of oral or systemic corticosteroids. If you have psoriasis, you're at greater risk of developing other conditions, including psoriatic arthritis, which causes pain, stiffness and swelling in and around the joints, eye conditions such as conjunctivitis, obesity, type 2 diabetes, high blood pressure, cardiovascular disease, other autoimmune diseases such as celiac disease, sclerosis, and inflammatory bowel disease called Crohn's, mental health conditions such as low self-esteem and depression. This is where holistic medicine can come into play. By working on optimizing all areas of your physical and mental health, you may be able to reduce a cascade of negative health conditions from occurring by taking the necessary steps to change your diet and your lifestyle, and to treat numerous areas rather than masking the symptoms with a prescription drug such as a steroid cream. Plantago major is an important medicinal plant with different pharmacological properties, including anti-inflammation, analgesic, wound healing, antipyretic, antitussive, anti-infective, anti-hemorrhagic, laxative, astringent, hemostatic activity, and as a diuretic. A lotion with plantain, calendula, and coconut oil is extremely helpful for any skin irritation, including mosquito bites, eczema, psoriasis, chickenpox, rashes, and sores. A tincture of broadleaf plantain can be taken internally at the rate of 5 milliliters 3 times per day for a 1 in 6 dilution tincture. This would be equal to half a teaspoon of pure plantain juice. However, it's very difficult to juice plantain as it's a fibrous plant. Borage seed oil is a nutritional supplement which is rich in essential fatty acids that can regulate the body's immune system and fight joint inflammation. A review of studies using borage oil topically and other GLA containing plant oils found that the borage oil has both antioxidant and anti-inflammatory effects, and it can be beneficial for people with atopic dermatitis. Borage seed oil will also treat all kinds of skin inflammation, including eczema, psoriasis, and rosacea. A typical dose is 1000 milligrams up to 3 times per day. Evening primrose oil contains the same beneficial ingredient GLA, or gamma-linoleic acid. However, borage oil is much better value for money, and only half the dose is needed. Iodine is applied to the skin for skin inflammation such as dermatitis and other skin disorders such as eczema and psoriasis, to kill germs and to heal wounds, and to prevent soreness inside the mouth or along the digestive tract, and to treat diabetic and other external ulcers. Nascent iodine is the safest and best form of iodine to use. Turmeric has also been used as a healing spice for centuries. It's popular in both Chinese and Ayurvedic medicine. Turmeric is thought to have powerful anti-inflammatory abilities that may help to relieve psoriasis symptoms. Curcumin is the active ingredient in turmeric. It's thought to be responsible for much of turmeric's healing capabilities. Doses of up to 5 grams per day of curcumin have been used, with its absorption being enhanced with either biopterin, which is black pepper extract, or by frying it in ghee, butter, or coconut oil, or consuming it with fish oil. Allergic conditions such as hives and virtually all autoimmune diseases, asthma, diabetes, psoriasis and other skin disorders, and irritable bowel syndrome all involve inflammation. Doctors in Europe and Asia have been prescribing enzymes in ever-increasing frequency for just about every form of inflammation for the last 30 years. Serrapeptase is a proteolytic enzyme. In other words, it breaks up and digests protein. The usual dose of serrapeptase is 10 milligrams 3 times per day, ranging from 15 to a maximum 60 milligrams per day. Increased occurrences of vitamin C in the body have been found to help to control oxidation in the body. A case study of one participant with severe psoriasis found that increased vitamin C eradicated the person's psoriasis within 6 months. Liposomal and intravenous vitamin C are the strongest forms. The next best form is non-acidic vitamin C, with the least effective being ascorbic acid, as it is too harsh on the stomach. The effect of vitamin C is enhanced when taken with bioflavonoids such as quercetin. Dose of vitamin C can vary greatly, and it can depend upon the type and the intended use. A comprehensive review of scientific studies published in the Journal of American Academy of Dermatology shows that omega-3 improve people's psoriasis symptoms in about 12 out of 15 trials. The benefits include improvements in skin reddening, itching, scaling, and inflammation. Doses range from 3 to 9 grams per day of an EPA DHA omega-3 fish oil blend. Molecularly distilled oil, which is guaranteed to be free of heavy metals or other contamination, is recommended. Garlic has strong anti-inflammatory properties and antioxidants that improve skin conditioning while preventing skin infections. While it's smelly, it does appear to reduce scalp psoriasis symptoms also. One protocol for allicin garlic extract for psoriasis states take around 1,620 milligrams of allicin powder capsules a day for 2 weeks. Reduce to 540 milligrams for a further 2 weeks. As a maintenance dose, take just one 270 milligram capsule thereafter to help to prevent further attacks. Cover all the plaques at least twice a day with an allicin gel. Vitamin E helps to support the immune system, cell function, and skin health. It's an antioxidant, making it effective at combating the effects of free radicals that are produced by the metabolism of foods and toxins in the environment. Vitamin E may be beneficial at reducing UV damage to the skin. There's different forms of vitamin E. Studies show the combination of alpha and gamma tocopherol supplements appear to be superior to supplementing with either form alone for inhibiting oxidative stress and inflammatory factors. People with psoriasis often have low serum levels of selenium, a potent antioxidant. In one study, vitamin supplements help to improve selenium concentrations in people with psoriasis. 3 Brazil nuts per day helps you to reach your daily requirements of the selenium. Vitamin D treatment is effective when applied topically to the skin for plaque-type psoriasis. Oral vitamin D supplementation might be effective as an adjuvant treatment option in psoriasis. You can get a 25-hydroxy vitamin D blood test to determine your levels and then treat any deficiency. Oral zinc gluconate at 90 milligrams per day showed significant clinical improvements. Topical 0.25% zinc pyridine applied twice daily was also found useful in plaque psoriasis. Oral zinc sulfate was efficacious in psoriatic arthritis. Like vitamin C, zinc's absorption is enhanced when taken with the bioflavonoid quercetin. Recent studies have demonstrated that patients with psoriasis have a significantly higher serum homocysteine level and a higher prevalence of hyperhomocysteinemia. We know that folic acid, vitamin B6 and B12 are all involved in the breakdown of homocysteine in the blood. Therefore, increasing your intake of folic acid and B vitamins may lower your homocysteine levels. A good source of folate can be found in fruits and vegetables, especially green leafy vegetables. A systemic folinate calcium, a folic acid derivative, and topical B12 have been found to be effective in treating psoriasis. Check out my video on the MTHFR gene polymorphism to see if you need extra B vitamins to control your homocysteine levels. Glutathione is known as the master antioxidant in the body. It supports and it helps to regulate many of your body's processes, including tissue creation and repair, but especially the immune system. In particular, it's been found to have benefits for the treatment of psoriasis. Glutathione can be increased by taking reduced glutathione at up to 1000 mg per day. N-acetylcysteine as the precursor at 500 mg 3 times per day. The herb milk thistle, and ensuring that you meet your selenium requirements of 200 micrograms per day, as this is needed for its synthesis. Taking nettle tea and a liver support supplement, such as milk thistle and dandelion, is a good idea for supporting the organs of elimination. Collagen is one of the most plentiful proteins in mammals. It's responsible for several biological functions, one of which is to provide structural support in connective tissues, muscle, and skin. Collagen is the protein responsible for skin elasticity. It also plays a role in joint and bone health. While collagen supplements may not be able to cure psoriasis completely, they can help with the symptoms in conjunction with vitamin C and a healthy diet consisting of whole foods. By decreasing inflammation in your body, this can prompt your skin to heal and for healthy skin to regenerate. Studies investigating the benefits of collagen supplements have evaluated doses that range from 2.5 to 10 grams per day. However, some supplement makers and other proponents of collagen recommend up to 30 grams per day. Vitamin K is well documented as a vitamin with anti-inflammatory potential. Although specific studies on the effects of vitamin K in psoriasis don't exist, the probable positive effect of its supplementation in psoriasis is supported by the documented decrease in TRL expression with oral vitamin K supplementation. The optimal dose of K2 per day is 300 micrograms. After this, your body will not absorb a higher dose, so it's just a waste of money. One should also see the work of Dr. Weston Price and his study of the dietary consumption of vitamin K2, which he even labelled Activator X, and its role in reducing all sorts of diseases and even extending lifespan. According to some research, aloe vera has been shown to help to reduce redness and scaling that's associated with psoriasis. The aloe plant gel can be applied to the skin up to 3 times per day. Aloe vera juice, which has been skinned, can be purchased as a drink, and this may be beneficial to the immune system and the skin also, but make sure that it's a sugar-free option. Foods that fight inflammation are fruits and vegetables, especially berries, cherries, and leafy greens. Salmon, sardines, and other fish rich in omega-3. Antioxidant-rich herbs and spice like thyme, sage, cumin, and ginger. And heart-healthy sources of fat like olive oil and nuts. Foods to avoid if you have psoriasis: gluten, dairy, processed foods, alcohol, caffeine, and nightshades. Red meat contains a polyunsaturated fat called arachidonic acid. This type of fat can worsen psoriasis symptoms because it can easily be converted into inflammatory compounds. Processed pork may be the worst meat, so you should also avoid sausage, bacon, and other processed meats. Psoriasis is associated with other serious health conditions such as diabetes, heart disease, and depression. So be sure to check out my videos on blood sugar, blood pressure, and cholesterol, as well as my videos on sleep and other ways to improve your mood, such as my video on lavender and on CBD. For more information about the herbs and supplements talked about in this presentation, go to my website.